Good morning, everyone, and welcome to today's training webinar, Where to Start Getting Access to PSYCKES. My name is Melanie Martucci, and I'm part of the PSYCKES Medical Informatics team, and I'll be going through the presentation today. I also have my colleague Dee Dee on the line, and she'll be helping to assist me with answering any questions. So before I get started with the presentation, I just want to point out that all of the phone lines have been muted to prevent any background noise during today's webinar, but you can still ask questions throughout the presentation by using the WebEx Q&A box, and this will be located to the right of your screen. If you are viewing the webinar in full screen mode, you'll hover your mouse over the green bar at the top and then select the drop-down arrow located on the far right of your screen, and then the Q&A option will be the first choice on your list. I'll be pausing throughout the webinar to answer any questions, and we will be sending these slides and the recording to all attendees shortly after the webinar by the end of this week. So here's the agenda for today. First, we'll go over a PSYCKES overview, which will include some information about the PSYCKES application, like what the data is in PSYCKES, what the population is, and a little about what quality indicators are and why they're important. Next, we'll talk about best practices or some recommended tips that you can use when you're implementing PSYCKES at your organization. And this is important to review before even getting access to PSYCKES because it will allow for your organization to plan for getting PSYCKES access. You can prepare for your organization and those who will be using the application. And then we'll go over how to actually put PSYCKES into your organization's established procedures, and we'll talk more about how to sustain those practices as well. Then we'll discuss the process for how your organization can obtain access, including the process of requesting access to PSYCKES, and I'll cover who is eligible for PSYCKES access. And then for those of you on the call today who may be your organization's security manager, you'll be using the OMH Security Management System, also called SMS. So we'll go into some details about the SMS application and talk about how you can enroll and manage PSYCKES users at your agency. Then lastly, I'll go over training and technical assistance, and we'll pause at the end to answer any final questions. So I'll start by introducing PSYCKES and reviewing what the PSYCKES application can offer your organization. And it's just important to note that for this webinar specifically, we'll be talking about PSYCKES for agencies that don't yet have access. So this is for agencies that may not know if they are eligible. So we'll go over a PSYCKES overview and then begin the process as if your PSYCKES is brand new and doesn't yet have access to the application. So I'll start with the overview about what is PSYCKES. So the PSYCKES application is an online web-based application that is secure and HIPAA compliant. And the purpose of the application is for sharing Medicaid claims and encounter data, as well as pulling data from other state administrative databases. So PSYCKES does this by putting this information in a user-friendly format, and it's really designed to support data-driven clinical decision-making, as well as data-driven quality improvement projects. PSYCKES does have ongoing data updates. We update all of our quality indicator reports on a monthly basis, and then we also have individual client-level clinical summaries that are updated every week. Who is viewable in PSYCKES? So the data in PSYCKES comes to us at the New York State Office of Mental Health from the New York State Department of Health's Medicaid data feed. And currently we have over 10 million individuals within PSYCKES. And individual recipients that are in the application are New York State Medicaid enrollees with fee-for-service claims or managed care encounter claims, as well as Medicaid reimbursed services for those who are dual eligible Medicaid and Medicare clients. And these recipients also fall within the behavioral health population, which means that they currently or in the past have received a mental health or substance use service, a psychiatric or substance use diagnosis, or were prescribed a psychotropic medication. And PSYCKES does provide all available data on a number of different topics. So we have general medical health, behavioral health, residential information, among others that we'll get into a little bit later. So here's some more information about the data that is available in PSYCKES. So again, we have client information that is coming from two different types of data sources. This information comes from billing, which provides us information from Medicaid fee-for-service claims and managed care and counter data across treatment settings. And then we also have that information from other state administrative databases in order to really provide a full picture of the client. And so this information is organized into the clinical summary, which provides up to 5 years worth of data. And again, that's updated on a weekly basis. And then we do have a time lag in PSYCKES, which can vary depending on a couple of different things. So first, it will depend on the type of information that you're looking at. So something like pharmacy claims are usually pretty quick and timely, and those will usually appear in the application within 45 days. It could be a little less or a little more depending. But then we also have inpatient and outpatient services that are in the application, and those will take a little longer from the time that the service occurred to the time that you'll see those services in PSYCKES. And this time frame can be around 6 months, so it really depends on how quickly the providers are billing for their services. And then once the provider submits their bill, it will go into managed care, and then that information gets submitted to the Department of Health. So it will depend on how quickly each of these organizations are turning these bills around. And then once that information is captured at the Department of Health, that is when we at PSYCKES get a weekly feed of the Medicaid data from DOH, and that's what is pulled into PSYCKES. Again, this is done every week. And then along with the Medicaid billing information we have in the clinical summary, we also have the information from those other state administrative databases. And those sources are considered more real-time because the lag is only 0 to 7 days. And some of those sources are listed here on this slide. So we have New York City Department of Homeless Services information, health home enrollment and CMA provider information coming from DOH MAP. We have managed care plan and HARP status coming from the MC enrollment table. We have managed care plan assigned primary care physician, and this one is updated on a quarterly basis, and that is being pulled from DOH. We have state psychiatric center electronic medical records. So if a client has spent some time in a state psychiatric center and their inpatient unit doesn't bill Medicaid directly, you would still get access to that information in PSYCKES. We also have assisted outpatient treatment provider contact information being pulled from TACT, assertive community treatment provider contact information from CARES, along with adult housing and residential program information. We have suicide attempt information being pulled from NIMERS, and this information from NIMERS is not limited to that 5-year look-back rule because it is such critical information. We also have safety plans, screenings, and assessments that can be entered by providers in PSYCKES My Choice. And lastly, we have IMT and AOT referral under investigation coming from DOH-MH. So that information is provided in certain reports in PSYCKES, and we do have 3 different types of reports. The first is the individual client level reports, and that is called the clinical summary. And this is where that Medicaid and state PC treatment history is provided up to 5 years. And then the second kind of reports are provider and managed care level reports. And within those, we have the MyQI report. And this can be seen at the provider level, at the managed care plan level, and at the statewide level. And those will display prevalence rates on all of our quality indicators. And you can also drill down into the indicators and see which clients at your agency meet criteria for those indicators. We also have the recipient search reports, and this is a way for you to run ad hoc reports to identify cohorts of interest. So within recipient search and PSYCKES, you can apply a bunch of different filters. You can layer on several different search criteria to look at groups of interest. And then we also have the PSYCKES usage reports. This is a way for you to monitor PHI access at your organization, so you can see what staff have access to PSYCKES, and you can get information on if they've been logging in, what clinical summaries they've been viewing, and you can also see how many consents they've entered and for which clients at your agency. We also have utilization reports, and this is a series of 3 separate reports that are designed to support providers preparing for value-based payments and forming provider networks. And then lastly, we have the statewide reports. And this is really just another way for you to look at those quality indicator reports, but this is at the statewide level. So these will be in aggregate form. So you are able to see all providers for an indicator within one list, and then you can apply filters for region, county, plan, and network. So now I'll talk a little more about the quality indicators, which are also known as quality flags. So New York State Office of Mental Health has identified a number of different health conditions or treatment issues that are important enough that they're worth tracking. And so what PSYCKES does is it tracks clients using these quality flags who may be positive for one or more of these health conditions or treatment issues. And this way, when someone does meet criteria and is positive for one of these quality flags, the provider, managed care plan, or local, county, state government leadership are made aware and can take necessary steps for improvement. These flags can also assist with supporting clinical review and quality improvement. And we do have a number of different quality indicators or quality flags that are broken into different sets. So when a client does meet criteria for one or more of the applicable quality flags, the provider agency is then allowed to access that client's clinical summary. So again, that clinical summary is the report that has up to 5 years worth of information across all treatment settings for that client. And then the other thing we do in PSYCKES related to quality indicators is that we roll up the information in aggregate form in order to provide the prevalence rates at the program level, agency level by managed care plan, region, state, and so on. And that way users can look at the prevalence rates and where there are areas for improvement. So as a provider user, you can use this information to help run a quality improvement project. And we do have some examples of the current quality flags included in PSYCKES listed here. So we have no diabetes monitoring for individuals with diabetes and schizophrenia, low medication adherence for individuals with schizophrenia, antidepressant trial of less than 12 weeks for individuals with depression, high utilization of inpatient emergency room hospital readmission, and then HARP enrolled and not assessed for HCBS, Health Home Plus, no Health Home Plus service. So those are just some examples of the quality indicators that we have in PSYCKES currently. We do have several others, and we also have a MyQI report webinar that we offer live, and then we also have recorded versions on our website if you are interested in learning more about MyQI report and taking a deeper dive into those details. So now I will talk about some best practices for implementing PSYCKES. But before I move on with that, I just want to check in with Dee Dee to see if we have any questions so far.
Hi, Marie. There's no questions in the QA box for now.
Great, thank you. So we'll go on to some best practices. And these are really just some lessons learned and some tips that are not required, but they have proven to be useful to some organizations during the implementation process. So we've organized them into 4 different areas, and I'll go into each of these best practices in more detail, but this is just an overview of what some of the recommendations are. And those include steps to plan. So when you are planning for your agency to get PSYCKES access, you can contact the PSYCKES Help Desk if you are interested, and there will be some documents that you will complete and return. And then you may want to establish a PSYCKES work group and determine some of the PSYCKES use cases at your agency. And again, we'll go into details about each of these steps pretty soon. But then we'll go on to preparing for PSYCKES access. So there is protocol that you will complete for granting users access to PSYCKES individually. And then you may want to develop policies and procedures, and then prepare computers and train designated staff. And then once you put PSYCKES into use, you can also establish procedures into practice for using the application, and then you may want to develop a plan to sustain those practices. So we'll start by talking about the planning process for PSYCKES access. And this process is really going to be unique for each organization depending on their place in the process. Some organizations may already have these steps completed, but again, for this webinar, I am going to go through the process from the beginning as if your organization is brand new and does not have access to PSYCKES yet. So if your organization is interested in getting access to PSYCKES, the first step is to find out if your agency already has PSYCKES access. And to do this, you will email our PSYCKES help desk at psyches-help@omh.ny.gov. And we'll be able to let you know if your agency currently does have access. And if we do confirm that your organization does not, then you can find out if your organization is eligible. And these are the types of provider agencies in New York State that are currently eligible for PSYCKES access. So if your agency has an OMH licensed program or a program with OMH oversight, agencies with an OASAS licensed program, but this does not include residential only programs, DOH recognized health homes and care management agencies, federally qualified health centers, local government units, BHCC networks and other networks, Medicaid managed care plans, DOH licensed hospitals, OMH designated adult home and community-based services, and freestanding medical clinics. So these are currently the types of provider agencies that are eligible for PSYCKES access in New York State. If your agency isn't on this list, please feel free to still email us at PSYCKES help, because we are always looking to add new access types and new organizations to our application, so we can further investigate and see if that is something we can do for you. So after determining if your agency is eligible, the PSYCKES help desk will send you a confirmation email letting you know that your agency is eligible, and we will also provide the next steps, which will include completing the PSYCKES Access online contact form survey, which is available at this SurveyMonkey link here. And then your organization will also be provided an electronic PSYCKES confidentiality agreement. And that will need to be filled out and signed by your organization's CEO or executive director. And then after that PSYCKES confidentiality agreement is electronically filled in and signed, you will just need to return that by email to PSYCKES help. So again, each of these items will be included in that email that will be sent from the PSYCKES help desk. And on the PSYCKES help desk, we do have a PSYCKES access team that will handle all the PSYCKES access requests, and that includes myself, my colleagues, Kristen and Michelle. So one of us will be in contact with you throughout the process after each step is completed, and then we will also provide any information for next steps and answer any questions throughout the process. So here is more information about what you'll need to provide on the Access online contact form survey. We do ask for some contact information like the name, title, address, phone number, and email address for the organization's CEO or executive director, the COO or deputy director, 2 PSYCKES point persons, and then any additional PSYCKES point person that you wish to add. You'll see that for only the CEO, we do also ask for a fax number. And then we will ask for the taxpayer identification number and the Medicaid provider ID if applicable. So for the PSYCKES confidentiality agreement, again, the organization's CEO or executive director will sign the agreement. If you do have someone other than the CEO or executive director that will be signing the confidentiality agreement, that person must have legal authority to do so. If we do receive a confidentiality agreement that is signed by someone other than the organization's CEO or executive director, then we'll just request to verify that the individual who signed does have that authority. And if we do need to do that, we just request that you send us an email with the CEO or executive director letting us know that it is confirmed that this other person does have legal authority to sign on behalf of them, and that is the proof that we would need in order to accept that confidentiality agreement. So by signing the confidentiality agreement, it acknowledges that PSYCKES provides access to Medicaid claims data and protected health information. You're agreeing to comply with all New York State and federal privacy laws and regulations. And then these agreements will also be countersigned by our OMH PSYCKES director. So this just shows a snapshot of what the PSYCKES confidentiality agreement looks like. So if you take a look at the top section, that is showing the top of the first page, which explains that this is an agreement between the New York State Office of Mental Health, and then the organization name will be filled in this first box. And this is a fillable form, so you can type this out and then save it and send it back to us. You'll see that the next step is to complete the date that the agreement was completed on. So I'll say the 31st of January 2023 by, and then this box will also be the provider name. The second image on the bottom of the page is showing the last page of the confidentiality agreement. So the bottom of page 5 is where you'll see the final section titled Authorization. So after reading the agreement, this is where the organization's CEO or executive director or another legally authorized individual will complete their name, date, and signature for the agreement. And then again, after these areas are completed, you can save a copy and then return the agreement to the PSYCKES help desk for our director's signature. So we recommend establishing a PSYCKES work group, and this is a list of some of the people that you may want to include. So leadership buy-in is great, and we've learned from a lot of organizations that having the support of leadership is really important because they're the ones that can encourage and promote the use of PSYCKES at your organization. Having medical staff can also be really important as well because they can promote the clinical use and explain how PSYCKES can help staff, especially with accessing client information and treatment planning. And then it is helpful to have a point person who can organize and oversee the project and be able to explain to staff how they can get access, how they can access PSYCKES trainings and other resources that are available as well. A quality manager may be useful to coordinate utilization of services. Next, training staff is always good to have, and some organizations may have staff that work to train and organize onboarding for new employees anyways. So PSYCKES training may be something that could be incorporated into other trainings that you may already be providing for new staff. And we do have a training webinar called PSYCKES Train the Trainer that is also available with previous recordings and slides on our website. And PSYCKES Train the Trainer offers a lot of helpful tips on how to do PSYCKES trainings at your organization. We also recommend having administrative staff and clinical staff a part of the work group because these are great people to have that can help discuss the current workflow and how PSYCKES can fit into that, and especially for things like obtaining and managing PSYCKES consent with clients at your organization. And then finally, you'll want to, of course, include the staff who will be using the PSYCKES application. So after establishing a work group, you may want to think about potential uses of PSYCKES and how people could use it at your organization, which staff could use it, and how it could be integrated into the current workflow to really improve efficiency and figuring out how PSYCKES can fit into what you may already be doing. One question to help determine that is whether PSYCKES is going to be used for clinical support, quality improvement projects, or population health management. So those are really the three main areas that we see PSYCKES used at organizations. So the organization's use case will really help to determine how PSYCKES can be implemented. So we have the client-level clinical summaries, which are used to support clinical reviews, treatment planning, care coordination, and discharge planning. And then the MyQI report in PSYCKES is used to support those quality improvement projects. And then lastly, we have recipient search and utilization reports, which can support population health management. So after establishing a work group, you can prepare for PSYCKES use. And when preparing for PSYCKES use, we recommend not only developing policies and procedures, but also documenting them. So we have some example policies available for using PSYCKES in clinical settings, but it's important to obtain any administrative approvals if you are implementing something new at your organization, and to have those workflows supported by all departments that may be involved in these changes and the use of PSYCKES. So we recommend that preparing PSYCKES forms and the PSYCKES consent form is one of the most important things to do when developing your policies for use of PSYCKES at your organization. Specifically, the procedures for obtaining that PSYCKES consent and having the consent forms available are really helpful. It's also a good idea to have a procedure for including the consent that is signed by a client in their chart or uploading a copy of that signed consent form to an EMR. There can also be an internal form or checklist created or revised to incorporate these PSYCKES procedures to provide really thorough instructions for whoever may be obtaining consent at your agency.
Hi, Melanie. There's a question.
Okay, great. What's the question?
Okay, it's from Nicole. She says, hi, my agency, Fidelis, already has PSYCKES access, and she's a new employee that is having difficulty logging in. Is she in the right training?
That is a great question. So this training, Where to Start Getting Access to PSYCKES, we're really doing more of an overview for how agencies as a whole can get access to PSYCKES. So just as you said, Fidelis does already have access to the application as an agency. So this webinar may not be the best if you are an individual user that already does have access. If you are experiencing any issues logging in, I would recommend emailing the PSYCKES help desk so we can provide that one-on-one support and help you log into the application. So again, this webinar is more coming from the view of you're a new agency and you may not even have access to PSYCKES yet, and how can we put PSYCKES into use at your organization? Are there any other questions, Dee Dee?
No, that was the only one.
Okay, great. Thank you.
You're welcome.
Okay. So when your organization is thinking of implementing PSYCKES, the workflow of the consent process, again, is really important. So when staff obtain client consent or determine that it may be a clinical emergency, this can be done by anyone on your team who you think is appropriate to get information. So it could be a clinician, it could be administrative staff. It is helpful to have copies of the PSYCKES consent form printed and available to staff. And you can also integrate the consent form with other paperwork that the client may already be filling out during their appointment. Establishing this process is important because it will help the efficiency of getting clients' consent, especially when there may be other circumstances that require some modification. So once a client does sign the consent form, someone at your organization that does have PSYCKES access will be able to log into the application And then that person can use recipient search to attest to your right to access the client's data. And again, workflow is really important here because the staff that may be obtaining the signed consent may be different from the staff that are enabling consent and logging into PSYCKES to enable that consent within our modules. So when establishing who will be doing this, it's important to know that any PSYCKES user at the organization can access client data in PSYCKES once the consent is entered into the application. So any user will be able to go into the PSYCKES application and look up that client to bring up their clinical summary, and they can have that available by exporting to Excel or PDF and putting that in the client's chart or EMR. And that's, again, really valuable because the clinical summary can provide up to 5 years worth of data on the client across all different treatment settings. So we do have other consent forms available that also have PSYCKES language, and those are the BHCC, Patient Information Sharing Consent, and the DOH Health Home Patient Information Sharing Consent. And we do have another webinar called Consent Emergency Quality Flag, PSYCKES Levels of Access, and this will discuss in detail the levels of access, what data is available for each of those levels, and how you can enable a client's consent within the PSYCKES application. And we have those recordings available in slides also on our website. So I'll stop here. Do we have another question, Dee Dee?
Yes, we do. From Hilda, they said that they have a user ID, however, they cannot access the PSYCKES website, I believe.
Okay, so if you have been given a user ID to log into the application, then the next step would be to set up a token. So we do have it's kind of like a dual authentication process when logging into PSYCKES. So you'll enter your user ID, and then you have to generate a random 8-digit passcode from a token, and that will be used to log into the application each time. So if you only received your user ID and you still need to set up those other steps, I would recommend, again, emailing PSYCKES Help, and that is psyches-help@omh.ny.gov. And our help desk is great. We provide support Monday through Friday, 9 to 5, and they'll be able to look up your individual user ID and get you access to the application. Are there any other questions?
Yes, one just came in right now from Wai Sheng. They said they requested the token, but they did not receive a response.
Okay, so after requesting the token, it may take up to 48 hours to process for OMH Security to send that out to you. And if you do want to check on that status, if it has been over 48 hours, you can either email our PSYCKES Help Desk, who can then reach out to the OMH Help Desk on your behalf and check on that status for you, or you can choose to email the OMH Help Desk directly, and their email is healthhelp@its.ny.gov. And I will provide all of this technical assistance information, including the email addresses, at the end of the email. Or not the end of the email, at the end of the webinar. Okay, so I'm going to move on to preparing computers. So when preparing computers for PSYCKES Access, you will see that you will need to have internet access, compatible browsers, and PDF readers. So PDF readers can be really helpful when you're using the export to PDF in PSYCKES. That's where a lot of the information can be exported to, like clinical summaries, MyQI report, and recipient search results. So you'll want to have that on your computer. Most computers do already have PDF readers built in. And then one other thing you can do is save PSYCKES as a shortcut on your desktop or in your favorites. So it's recommended that you bookmark the homepage, which is www.psyches.org, and not that login screen where you enter your user ID and passcode. So by bookmarking this homepage at psyches.org, it will bring you to our PSYCKES homepage, And then there's a big link in the center that you can click Log into PSYCKES each time you want to log into the application. Sometimes when people favorite or save the actual login screen where you put in your user ID and passcode, it can cause some login errors. So again, we do always recommend going to the PSYCKES homepage at psyches.org first, and then logging into PSYCKES from there each time. So when training designated staff, you will have the security managers that will need to be trained on how to use the OMH security management system, and this is how individual users are granted access to PSYCKES. Then you'll want to train PSYCKES users on the functionality of each of the tabs and the reports. And if the designated trainers for PSYCKES don't have enough time to cover each of the functionalities, we do have live and recorded training webinars available on our website for each of these topics. Staff should also be trained on the PSYCKES related workflow, so documentation, privacy, and information security procedures. Since PSYCKES does use protected health information, it's really important to make sure that all staff understand the policies and procedures for using this type of information. And we do have resources available like a training recommendation document and those live and recorded webinars through our PSYCKES website at psyches.org. And then again, that PSYCKES Train the Trainer webinar gives some details about how to train staff in using PSYCKES. So now we will discuss putting PSYCKES and established procedures into use. So after you've planned and prepared for PSYCKES implementation, PSYCKES can be put into use in accordance with the plan that's established by your work group. And it may be helpful to have frequent users of the PSYCKES application available when your agency does get access, so that they will be able to monitor operations, identify any challenges, and answer any questions in regards to the PSYCKES access at your agency. So after spending time planning and putting those procedures and workflows into practice, it's important to sustain those practices. And some of the things that can be done to sustain practices are auditing the use of PSYCKES. So this can be done by checking the PHI Access module and seeing if staff are using the application and also how they're using it. When you have new staff, it will be helpful to provide access and trainings. And then when staff are no longer working at your agency, their tokens will need to be deactivated by the organization's security manager to revoke their PSYCKES access. Monitoring the PSYCKES usage plan and making any necessary changes. And then lastly, the PSYCKES usage reports are available for monitoring use. And I'll just show you what those look like. So this is where the usage reports can be found. You can see at that top toolbar when you click usage, there are 3 different types of usage reports. We have the PSYCKES users activity report, and this will show you who has access to PSYCKES, when the last time they logged in was, and this can be selected for a specific date range as well as optional selections for the user's role in the organization if you know that information. You can also look up by setting and program type and if they are licensed or not. Then the second menu is the PHI Access module, and this will have current users' PHI access use. So this will show you who is entering consent at your agency. And then lastly, the clinical summaries will show you which client clinical summaries have been viewed and by which staff. So each of these 3 reports looks very similar to the one shown here. You're able to apply specific date ranges and different user details to find this information. So next I'm going to talk about the PSYCKES access process in more detail, but I just want to check in with Dee Dee again to see if we have any questions.
I think we did answer this, but Cherie did say, is there a way you can show the actual workflow consent process?
So the workflow consent process that we have is usually done in the recipient search tab in PSYCKES or the registrar menu. And we do have an entire webinar that's dedicated just to going through that consent process and what that looks like in PSYCKES, and that is called the PSYCKES Levels of Access webinar. And that one is a really great resource to have because it does go through each of those steps in detail for consent, and not only consent, but also what you would do if you're attesting to a clinical emergency or entering any of those other consents like the BHCC or the DOH 5055 consents. So I would recommend going to our website and either signing up to see the live training for the PSYCKES Levels of Access webinar or viewing the previous slides. So I'll go into some slides here about PSYCKES Access. And again, this is from an overview as if your agency does not yet have access to the application. So the protocol for PSYCKES Access is to complete and return the documentation to obtain organizational access to PSYCKES. Then you'll sign the CNDA for access to SMS, which SMS, again, is the application that is used by the security managers at your agency. Number 3, you'll designate security managers. Then the security manager is who will enroll PSYCKES users at your organization. And then the security manager can also revoke PSYCKES access when staff no longer require it. And we'll go into more detail about each of these steps. So the first is that confidentiality and non-disclosure agreement. So in order to get access to SMS, which again is the application that security managers use to grant individual user access to PSYCKES, the CEO or executive director will need to first sign the confidentiality and non-disclosure agreement, also known as the CNDA. And it's important to note that the CNDA is different from that PSYCKES confidentiality agreement. So while the PSYCKES confidentiality agreement is signed for PSYCKES access and co-signed by our director, the CNDA is different because this is an OMH document, and it's defining your organization's responsibilities with regards to information obtained by any and all OMH applications. And it's required to ensure that an organization understands its responsibilities regarding access to and the use of data. This must be signed before access to SMS by the security manager. So what is SMS? Again, this is another OMH web-based application, and organizations use SMS to authorize staff to access certain OMH applications. So SMS is used for the patient characteristics survey, CARES, NIMERS, MHPD, as well as PSYCKES. So you may already be using SMS if you're a security manager for your agency and you have access to these other OMH applications. But the security manager is designated by the CEO at your organization, and they will grant users access to OMH applications like PSYCKES. So organizations that are already registered in SMS may already have a designated security manager or multiple security managers. So if that is the case, you do have the option to keep the same security manager, or you can designate new security managers just for PSYCKES access. If you do have a new or additional security manager that you want to assign at your agency, you will contact the OMH Help Desk to request the SMS self-registration email be sent to the CEO or executive director, and then that email will be forwarded from your CEO or executive director to any person that wants to be appointed as a new or additional security manager. And in that email, the security manager will have a link, and they'll be able to enroll as a security manager and then be able to grant PSYCKES users access. So for organizations that are not already registered in SMS, OMH or ITS will email instructions to the CEO or executive director on how to electronically sign that CNDA. And then the CEO will follow the instructions to sign the CNDA. And then once that is signed, then OMH or ITS will email the CEO that self-registration link in the SMSSR email, or the SMS self-registration email, and the people will use that who wish to become a security manager. So when you're designating security managers, we do recommend having more than one, just for cases of people no longer being employed at an agency. We like to have backup in case someone does leave, and then there is backup to have someone assign and revoke access as needed for PSYCKES. So OMH or ITS will email the CEO the self-registration link that is needed to assign one or more security managers, and the CEO will forward that SMSSR email to anyone who wishes to become a security manager. In that SMSSR email, there will be instructions to self-register as a security manager. And then once you register, OMH will email the security manager with a user ID and security token. And then that security manager can follow the instructions that are provided with the token in order to set a PIN and log in to SMS. So the work group can determine the staff that will require PSYCKES access and whether or not they already have an OMH-issued user ID. And then staff who will be responsible for enabling PHI access, which you can do that by using recipient search or the registrar menu. You can also designate staff who will be able to go into the registrar menu and fill in or print out that PSYCKES consent form to have on hand. And then lastly, the enrollment information from users can also be obtained by the work group and passed on to the security manager. So if you want to designate someone who may send the request to the security manager for new users, that may also be helpful. So individual users are granted access in the OMH security management system. And again, to do this, the security manager will use SMS to grant PSYCKES access to staff by checking the PSYCKES Medicaid access box option, and this will be in their SMS user account. So every PSYCKES user will get his or her own user ID and token, so they aren't supposed to be shared with anyone at your agency. Everyone gets their own. Those who do have OMH tokens for other applications like NIMERS or MHPD, you can use that same user ID and token for your PSYCKES access. If you don't already have a token and a user ID, the security manager will be able to create a new account for you in SMS, and this will generate a request for you to receive a user ID. So after the PSYCKES Medicaid box is checked in SMS by your security manager, this is what grants an individual user access to PSYCKES. And it also automates a request to OMH security. So once that request is automated, the user will be emailed their user ID and a temporary password for the self-service console. And the self-service console can be accessed at mytoken.ny.gov. And again, this automated request sometimes does take up to a few business days to process. So if you haven't received your user ID, but you know that your security manager has granted you access, I would give it a few business days. And if you still don't receive it, then you can always contact either PSYCKES Help or the OMH Help Desk for a status update on that. And again, I'll provide that contact information at the close of the webinar. So from within the self-service console, once you get that user ID and temporary password, you'll be able to log in. And in the console, you can request your token. You can also set security questions. You can reset PINs as needed. You can activate your token, and you can request a replacement token if needed. So we do recommend that all users set up security questions in the console so that you can reset your own PIN if ever needed. And this is just a way, if your PIN for some reason isn't working, by setting those security questions, you'll still be able to log in to the self-service console so that you can reset your PIN on your own instead of having to reach out. It may just be a faster process. So I'm going to show you a little behind the scenes of what the security management system looks like. And again, this is what the security managers use to grant individual access to PSYCKES. So again, SMS is used by the security managers, and the CEO will appoint the security manager, who will then register an SMS using the instructions provided by OMH and ITS. There is a self-registration page where the person will enter their name and title, email address. There will be a mailing address if someone does prefer a hard token. You will enter a phone number and existing OMH user ID if you have one for your agency, and then a token will be sent if needed. This is what that self-registration page looks like within the SMS application. So again, there's some required information that needs to be entered. And then this is the RSA Secure ID token. So a security token, again, is required for the login process to OMH applications, including SMS and also PSYCKES. So you'll use your token to log in to either of those, whether you're a security manager or just a PSYCKES user. And we have the soft token, which is placed on a mobile device. So it can be an iPhone, an Android, a BlackBerry, and that is what is shown in the top right, the soft token for a mobile device. And then we also have a hard token at the bottom right. And this is a physical keychain, and this is mailed to the security manager or the user, and it just depends on what mailing address the security manager has in the SMS system, because that is where the hard token will be mailed to. And we do have users that use the hard tokens, but I would say that the soft token on the mobile device is the preferred token method. But if you do have justification for using a hard token, like maybe you're not at the same computer every day, you can't have your cell phone on you in your work environment, then a hard token may be the better fit for you, and you can always request that through the OMH help desk. So then once you have a token, you'll be able to set your PIN during your first login. So this is what the security manager login page for SMS looks like. And then once the security manager logs into SMS, your page may look like this if you already have a list of users. If you're currently using other OMH applications, you may already have a user list like shown here, but it could be blank if you have never used an OMH application before and your organization is brand new and just using PSYCKES. So one thing that is important to know on here is that you can create a new user, or you can also edit users by clicking the pencil icon. It's shown next to the user ID on the left. So if you do work for a large agency and you have a long list of existing users, instead of looking and scrolling through each user on the list to find a specific one, you can also use the search function. You can type in the person's name or their user ID if you have that information, and if the person already exists in SMS, and search for them that way. And then after completing the search for a specific user, you can edit that person's account again by clicking on that pencil icon, and that will open up the person's information. And this is what the account will look like once you've opened it up, and you'll be able to scroll to the bottom, and you can find the section where it says PSYCKES Medicaid, and then you can check off that box. And by checking that box, that is what grants the user access to the PSYCKES application. Then just make sure you're clicking Update to save those changes. And then in another example, if you don't see the user part of that existing list, you also have the option to create a new user by clicking New User in the bottom right of the screen. And this is the information that you would complete for a new user. So the user ID will automatically generate for a new user, so you can leave that box blank if the person doesn't already have an assigned user ID. You can add their first and last name, their email address, and it's really important to put the correct email address for that user because this is where the information will be emailed to from OMH and ITS regarding logging into the Self-Service Council and token information. So it's important to have that email address correct in there. And then we also send release notes and application updates to that email address. So any PSYCKES communications will also be sent based on the information that you're filling out in SMS. So after adding all of the new information for the user, the last thing to do is scroll down to the groups and just check off that PSYCKES Medicaid box because again, checking off that box is what grants the user access to PSYCKES. So tokens and information for the Self-Service Council should be sent out within a day or two of granting PSYCKES access in SMS. So just make sure staff are aware and keep an eye out for these communications. And then if after a week they still haven't received the email, try checking the spam and junk folders. Sometimes the OMH and ITS emails go to those. So it's always good to check those just in case. And then one other thing is to make sure that the security manager did check off that box in SMS where it says PSYCKES Medicaid. Sometimes new user accounts are created, and if the box isn't checked off, that won't grant PSYCKES access. So it's always important to make sure the security manager does that final step. And then if that is all checked, then you can contact the OMH help desk and request that the token be sent to you or check in on the status of that token. So when new users log into PSYCKES for the first time, they'll create a personal identification number or a PIN, and that will be used on all subsequent logins. So the PIN will contain 8 numeric digits. It cannot start with a 0, and then the PIN cannot have sequential and consecutive numbers forward or reverse. And we have some examples of those listed here. So we do have a lot of login resources. Again, this webinar doesn't go into much detail about the process of actually logging into PSYCKES as a new user or an existing user. So I do recommend going to our website here. And in the left navigation menu, you can see login instructions. And if you click there, we have information on the Self-Service Council. And then we also have information on how to set up security questions, how to reset your PIN, requesting and activating tokens, and then troubleshooting token issues if you are receiving error messages or having any difficulty with the actual token. And then we also have token instructions, login instructions, and then login help right here. That is the contact information for our help desks if you are having token and login support. And I do have that on a final slide, a little bit bigger, so it might be easier to see. So I'll go to that now. So here is our training and technical assistance. Again, that can be found at psyches.org. And we do have live webinars that you can register for on the PSYCKES training webinars page, along with recorded webinars available. So some of those that I mentioned earlier, if you want to get more information about the quality indicator reports, recipient search, clinical summary, PSYCKES levels of access, so how to enter consent, emergency, or quality flag access. We have information on PSYCKES mobile app for iPhones and iPads. Introduction to PSYCKES is an overview of each of the tabs in the application. And then this webinar, where to start getting access to PSYCKES, and then we also have Introduction to the Self-Service Council. Along with those webinars, we have some user guides and short how-to videos available in the PSYCKES training materials as well. And then this is just the help desk support information. So PSYCKES Help, we're available Monday through Friday, 9 to 5 for any PSYCKES support, and we can be contacted at psyches-help@omh.ny.gov. And then for any ITS help desk support with tokens, logins, or using SMS, you can contact the OMH help desk at the phone number there or healthhelp@its.ny.gov if you're an external provider. And then if you are an OMH employee, you can contact the OMH employee ITS help desk at the 1844 number or at fixit@its.ny.gov. So that is all of the information I have for you today, but I will check in with Dee Dee before we end to see if there's any final questions.
There's no final questions.
Great, thank you. So I hope everyone has a wonderful rest of their day, and if you do have any further questions, please feel free to contact us at PSYCKES Help. Thanks again.